You are now on your clinical rotations. You are well educated, properly, thoroughly. Undergrads happen. High school.
You're a thoroughbred now.
You're thoroughbred. Proper word.
Those were 3 points that you should take into consideration before you open your mouth in front of an attendant.
Keep your mouth shut. What's up, guys? Welcome back to another video of Pen and Needle. In this channel, we mainly talk about, stuff that we're interested in as medical professionals and residents, and the perspective of an MD versus DO. We kind of go into everything, but specifically today,
talking about how to ask questions during your third and fourth year to impress your attendings.
Yeah.
So we'll be discussing 3 points, so stick around till the end to know all of them. So point number 1, I think it's asking attendings about their specific treatment plans for patients.
Yeah.
A lot of times what we see in the hospital differs from the textbook. What you learn in New World and what you learned in basic sciences is different from what you see happening on the hospital floor. So that's a good opportunity to ask your attending why they're doing what they're doing, because a patient is not just like one isolated disease. The attending understands the individual physiology of that patient much better, and they tailor the treatment plan to that patient. So that's a very good opportunity to learn what the train of thought of the attending is for that individual case.
Yeah.
So I think when someone comes in, let's say for appendicitis, and they choose to treat with antibiotics, instead of going into surgery, taking them into surgery, you can ask the attending, hey, why did you pick treating with antibiotics versus taking them to surgery? And then when they tell you the answer, it'll help you remember it better, and for next time, if you happen to see that patient, you'll understand why.
Yeah, and like 2 things about this specifically, right? So I remember a personal thing was when I was in my emergency medicine rotation, there was an attending, I remember there was a case of, I believe appendicitis, right? Appendicitis in a child, right? And he went straight to the CT scan. And, you always learn that, first best test is going to be ultrasound. And so this is something that's in the medical textbooks and what you're going to see on your board exams, because definitely answer ultrasound when you get that. But him jumping to the CT scan kind of stood out to me. So when I asked him specifically about, hey, why did you jump to CT scan? It's not like something that he didn't understand, that, okay, this person is just asking me a dumb question. Like, this is something he can look up, because this is something that you learn. But it's contrary to what you learn. Or, well, not contrary, but it kind of goes over and glosses over that fact and jumps right into the actual imaging that you need to get to. And when he told me that, ultrasound is only about 50% specific to show you what it's going to show you, he's like, why would I waste my time on that when I'm so confident in my diagnosis that if I just do a CT scan, right, and I can get to the diagnosis quicker, why not do that instead? So that also, second point being, is that that's going to show the attending that you were actually thoughtful enough to recognize that fact, right? And the fact that you asked him his own personal perspective, or let's just say it's not about him glossing over the fact of, it could be anything, right? His specific treatment. You might know that this specific antibiotic treats XYZ, and you see that, and he doesn't use that antibiotic, and you ask him about something else, or whatever treatment plan he did. That attending is going to think like, okay, this person's giving a lot of thought into their question, they're bringing in their prior knowledge and bringing it in, and it's going to impress them, and when you ask about a more personal thing to them, it's going to open them up more to you, and you're going to get more and more comfortable with them. They're not going to see you as some type of dumb medical student that's coming in with no knowledge, because I was a dumb medical student.
We're all a dumb medical student at one point.
Yeah, but I was asking dumb questions, like straight up. I didn't even care. In rotation, 0. I cared. I was like, I'm gonna ask a dumb question. If I learn the hard way, I learn the hard way.
That's how you learn.
Yeah, but that's not how you get a letter of recommendation.
Yeah.
Letter of recommendation also matters. So if I was to go back and do things over, I would kind of also touch on that.
Yeah, I mean, for every question, there's a better way to word it. You can put in minimum amount of effort and make it sound 100% better.
Yeah.
Instead of being like, what is appendicitis? You can be like, why does this person have appendicitis?
But also point number 2, right, is that asking more research related questions, right? The questions that are on the cutting edge of the floor, because a lot of times attendings are not going to know about the specific advances that are happening. They're used to practicing in their own way, right?
Yeah.
For such a long time. And new research comes in, they're going to appreciate you knowing about the research, number one, bringing it to light, and asking them questions about it, and maybe advancing their knowledge at the same time. So that's also another way of developing rapport with the doctor. I remember on my surgery rotation, for example, right, there was a skin graft that we had to, it was a plastic surgery rotation, and it was a skin graft that needed to be placed on a patient, right? And I asked the plastic surgeon, who I actually love, like, why does this skin graft, how long does a skin graft last outside the human body, right? He didn't specifically know, he just knows it's for a longer time, but he's like, great question, you should look it up. And I did look it up. I looked it up and I told him these were the XYZ research articles that I found, and different mediums do different things. And then he's like, great point, you should do research on it, you know? So that also opens up a door for you. Maybe you could do research with the attending on a specific topic. So these kind of questions are more also productive for you.
Yeah.
They allow you to become not only closer to the attending, more memorable, but maybe it'll allow you to collaborate with them, which is very, very helpful on your applications, right? And yeah, point number 3, what would you say it is? I think it transitions beautifully into point number 3.
So point number 3 is, as I said earlier, do some research before you ask a question. Don't ask a question just for the sake of asking a question and trying to impress the attending.
Oh, yeah.
Do a little bit of research. Look it up on Google, look it up on Up to Date, and read a little bit. And if there's something you don't understand, then ask the question.
Yeah.
Right? If there's, let's say, this hyperkalemia, right? Hyperkalemia, you read on Up to Date, you kind of like understand everything, but you don't understand how hyperkalemia happens in this one instance, in this one patient. Then you can go to the attending and ask them, hey, look, I researched this, hyperkalemia. I looked up how it happens, but this one point I don't understand.
Yeah.
The attending will appreciate that you took the initiative to do your own research and to read up on it, and then you ask the one specific question instead of asking him, what is hyperkalemia and how does it happen? Yeah. That is something you can read up on Up to Date, and you should know at that point.
Yeah,
right?
Know that these attendings have a lot on their plate already, right? They don't want to be asked dumb questions. And trust me, when I was doing my rotations, I was doing this left and right, and which was a bad thing. If I was to go back, that's one thing I would definitely change. Come with some type of knowledge. Don't just be dumb. My whole approach was, if I make a mistake there, it would help me learn more, and it did, right? And you can do that sometimes, but at the same time, know that you're there also for your own learning and for a future benefit for yourself, where you want a letter of recommendation, where you want to, progress throughout your clinical experience, right? All these 3 things, I think, kind of tie in beautifully to help you stand out when you're coming in.
You know what's a good exercise?
What?
It's called thought exercises, right? That's what Einstein did to come up with his...
Oh yeah, I know what you're talking about.
So before...
He carried out whole experiments in his brain
so
without
I think people should actually do that with the actions they are about to take. Just try to do that action in your head and think what the outcome would be. Is the outcome really what you want, right? Before you take that action, and then you'll really understand if you really should take it or not, right?
Yeah, think about what you're about to say.
Yeah.
Right. Don't just think like, oh, I need to know about this right now, but think about it and look it up, because you came to a point in your life where you have succeeded for your first and second year of medical school. You are now on your clinical rotations. You are well educated. Properly, thoroughly. Undergrads happen. High school.
Thoroughbred now.
They're thoroughbred. Proper horse. Forte. But all these things have made you have some confidence in yourself. Yeah. That's one thing that they look for. One thing that I saw in my evaluations was they always said he needs more confidence. I was like, okay, that's I at first I took that as a backhand slap.
Yeah.
Confident.
Yeah, you know what they said for me?
I am confident.
They said I was very quiet.
Yeah?
Yeah.
You don't ever show?
They said he needs to speak up more. I'm like, what?
They said that for me too.
Yeah.
And I was like, dude, I do speak.
Yeah.
But I speak when spoken to.
Yeah.
I don't want to get slapped.
Yeah, I didn't want to just get in the way for no reason. Plus, there was like nothing, like if most of the things, I did look them up and I found the answers for them. And I didn't feel like I need to show off that much. So I just like if I knew the answers when they're asking questions, the answer. I just didn't want to be a show off.
Yeah, and there was this one surgery resident
Yeah.
that totally hated me.
Yeah.
Because I asked the most dumbest questions.
That happens every so often.
At one point, she would just straight up ignore me. Like, I'm asking her a question. I'm like, hey, so what is this? And she acknowledges me. She said, okay, what's up? And then I ask her the question, then she just walks away.
Yeah.
Straight up, no response, no nothing. Because at first I thought it was a messed up thing to do.
Yeah.
Like, come on, man, I'm trying to learn. But now I'm realizing, I'm like, dude, that's so dumb of me to do. I'm like, why can't I just look it up?
Yeah.
Why would I burden them? Because they're already handling so many more things than me.
Yeah.
And I'm just annoying them. Don't be annoying in your rotations, right? You don't want to get to that point where you're just like kind of a nuisance. You want to help them. In your rotations, you want to actually help them while they're helping you. And that's when you're going to stand out. You know? And all of these things are going to help you get that LOR.
Yeah.
Yeah.
So, yeah, guys, those were 3 points that you should take into consideration before you open your mouth in front of an attendant.
Keep your mouth shut.
So, we'll see you in the next video.
Yeah,
then,
catch you guys
right?
in the next one. If
All
you
right.
guys like this video, make sure
Like
you
and subscribe.